This is deep dish, right?
Yeah, well, let's get deep.
So I'm going deep on both sides.
Dr. Webb, welcome to the platform. How you doing?
I'm doing great.
It's an honor and a pleasure to have you on Deep Dish Conversation. So thank you for the time. And I always love giving people their flowers, especially here in Nashville that's doing the work that you're doing. So a whole bouquet of flowers going to you for just, putting in the work, especially around healthcare and saying what needs to be said, but also just doing the work in the community, specializing in North Nashville, marginalized communities that have been neglected when it comes to healthcare and just healthcare deserts in general. So thanks. Appreciate you. Thank you.
I want to say thank you for the flowers and thank you for having me.
No, for sure. You gotta take your flowers.
Absolutely.
You have to take your flowers because sometimes people won't give them to you. Sometimes you either got to give them to yourself or just accept the ones people give to you. So I'm gonna make sure I'm intentional from black man to black man, especially to do those type of things when I have guests like yourself on the show. So
well, I don't take it for granted. So thank you.
Yeah. And so I want to get straight to healthcare. But I want to get in your journey because you didn't just get here by happenstance, right? It took some work, took probably a little luck, but you had to get to this point. And so can you walk us through a little bit about, coming from Mississippi and making your way into now being the CEO of Nashville General Hospital? You can give us a condensed version because I know It's a long story. But you can give us a short version. I definitely want to get that part of it as well.
Okay. Yeah, I was born in Clarksdale, Mississippi, and attended school there, elementary, junior high, high school, and the community college there, Coahoma Community College. It was called Coahoma Junior College back in the day, but I attended there, advanced in the sport of basketball, and had scholarships. So I selected Tennessee State University. Attended Tennessee State University, played ball there, and that led me to a master's program, and then I'm going to come back to this a little bit later on because it is a major turning point. It contributes to a major turning point in my life as well. But for this segment, moved on to seek a job after that, which was in the entry level of healthcare at a local hospital here in Nashville. And from there, learned about healthcare and decided that I wanted to pursue healthcare administration. So I was actually in healthcare. Hadn't planned to go there, but that's where the job was, entry level. So learned about the nuanced and the in-depth activities of healthcare and healthcare delivery. So attended the University of Alabama and pursued a second master's degree in healthcare administration. After that, they do a residency program with a company, a corporation, or a healthcare system. So I finished that and was retained by that organization. And within about a year and a half, as assistant administrator at that facility, I was promoted to the CEO of that organization, and that started my pathway of administration. Started in behavioral health, and so learned about that. As a matter of fact, the first job in Nashville was in a behavioral health facility, so I learned about a lot of the issues of mental illness and how individuals cope and how those disease processes were treated and all of that. So as I went into behavioral health, I was there for probably five or 6 years, and then transitioned into the acute medical side of healthcare, and that was in Memphis. So I went from South Carolina, Myrtle Beach, to Memphis to become an executive in the healthcare system there, and that's where I remained for a number of years. Ran hospitals there, and before coming back to Nashville.
Come back home. Come back your second home.
Yeah.
Well, growing up in Mississippi, did you see what was your representation of healthcare? Growing up back then.
Well, there was a county hospital.
Okay.
Where I was born. I was a teenager, probably 15, 16, playing sandlot football in the backyard with my brothers and some friends, and ended up with a broken arm.
Of course.
And ended up in the hospital, going to the hospital to get my arm fixed. I had an appendectomy, had to go to the hospital for that, and that was my experience.
Yes. Yeah. Did you, as you started to become a professional in healthcare, did you ever look back and say, like, we didn't have these things growing up in my community when it came to healthcare, or like maybe my community was neglected from a healthcare standpoint growing up?
Absolutely. After I learned more about healthcare and the healthcare industry, and the concept of access to healthcare, yes, I certainly did think about that, and I spent a short period of time back at that hospital in an administrative role later on. So, yep, absolutely.
What was that? Because I'm just gonna assume, like, you growing up during a period too where you having civil rights, Jim Crow, that area, that time period is happening, and so how did that even affect or play a part in your psyche about what you could and were able to do or inspired to do growing up from a child to adolescent to a young adult to an adult?
Well, I grew up in a period where, school segregation was very prominent. I mean, we had the schools for African Americans and schools for whites, and never the two shall meet.
Right.
Shortly before I left high school, they became integrated. So that was my first real experience. I'd never gone to school with a white kid before that happened.
Yeah.
And that was my senior year in high school. So I ended up shifting over and going to a different high school, from the predominantly black high school to the predominantly white county high school for that year before going into the community college. But I played basketball, so a lot of the things that some of the kids had to deal with there, I didn't, because of my status as an athlete.
Yeah. So the world is changing. United States in particular is shifting. Right as you're, becoming 18 years old, becoming an adult. And so during your journey, did that come with any particular challenges, being like, hey, like culture shock, now that everything is becoming more miscegenated within the United States?
It was eye-opening. I mean, simply because a lot of the things that you had experienced within that protected environment of your community, where you did not interact with that race, became new to me. So I had to, and all my friends had to adjust to how we were dealing with this whole new opening. But it wasn't really that, for us, it wasn't that big of a deal. We accepted it pretty readily and acquiesced and did what we had to do.
Right. Did racism come into any part during your journey from schooling? Well, you went to TSU, so you're still in the all black environments, but even from a professional standpoint, going into healthcare, being a black man, were there challenges that you had to navigate that you feel it was particular due to who you were as your ethnicity, as your race?
Okay, so that would be post TSU and the time that I spent in Nashville. Which, of course, there were still issues there with race. The early days, the mid '70s in Nashville. Go back and look at some of the unrest that was going on at that time, some of the race issues that were going on, and that was high-level civil rights and protests and marching and all kinds of things going on in the '70s. It was a very active period for that activity. Now, fast forward, going into healthcare, after graduating with a master's from the University of Alabama and then moving to South Carolina to actually engage in the career. There were issues, but then there were issues growing up as well. So for me, it was just a continuation and just understanding how to deal with, navigate those conditions. It was just all pretty nuanced to me as I transitioned.
Who was your support system, or what did that support system look like as far as navigating that? A lot of times, many black folks especially, a lot of times are the first in many cases, or their family or their community do a lot of things. They first jump out the window. But a lot of times, it jump out the window comes with broken glass and bruises and things like that. You need people to help you bandage those, put Neosporin on. What did that support system look like for you? And who were those people on your good days and your bad days when you feel like, man, I don't know if I can do this, or this is getting really, really hard for me?
Yeah, it's a great question. So I had older brothers.
Okay.
Who had gone into higher education. They graduated Jackson State. I went to Tennessee State, they went to Jackson State. But they became educators. And while I knew I was going to continue and get degree and become, a professional, at first I thought it would be in education or coaching or something like that. By my taking a different direction with my career and going into healthcare administration, there was a certain amount of insight that they could give me, but they had no idea of how to navigate, the industry of healthcare, and that became my world. And living in, first full-time real job that I had as an executive was in South Carolina. So still deep South. The support system that I had was basically the people around me. There were not many, and still not, as far as the ratio is concerned and goes, the ratio of African Americans to non-African Americans that are in top leadership positions in healthcare is still skewed. So it has been that way. It is still that way. And coping was just a matter of day-to-day understanding and preparation.
I want to get into that current status right now. So when we talk about diversity, equity, inclusion, we all understand now in this country there's an attack on trying to be a diverse, equitable, and inclusionary organization. And we talk about healthcare, where it's already screwed on many levels when it comes to diversity, inclusion, and equity. What are your thoughts on trying to protect that idea of being able to have a diverse, equitable, and inclusionary environment in healthcare, and make sure that black and brown folks can get in C-suite level leadership in healthcare?
Now, this is a challenge that didn't just develop, right? It didn't just happen. This has been over a period of time. My best advice to anyone, particularly minorities and particularly African Americans, is preparation. Come to the table prepared, because we've heard all of our lives that the playing field is not going to be level for you. So you've got to be able to perform, and you've got to have a good command of the skills and the expertise that are required. I still have to do that and make sure that I stay on top of the issues, that I'm looking for outcomes and processes to be in place to make sure that the things that are deliverables, that I'm able to deliver on those things. So just performance, and your performance is an outcome of your preparation. So you cannot change the structural aspect of the country. It's been in place for hundreds and hundreds of years. You can mitigate the effects and you can mitigate the impact on yourself by making sure that you are coming to the table prepared and ready to get the work done.
What happens to healthcare, or what is the end result of healthcare, or a result of healthcare, if it stops being diverse, if it stops being equitable,
Well,
if it stops being inclusionary?
You see, you want a good example? COVID.
Okay.
That's what happens. The disproportionate impact of COVID, mortality, death, and the morbidity, the number of people that contracted it, the number of people that died from it, disproportionately affected people of color and marginalized populations. And that's a microcosm of the healthcare within our country, is that one of the statistics that we should pay close attention to is the maternal health. The mortality rate of an African American woman compared to her white counterpart, she's about 3 to 4 times more likely to die from a maternal related condition. Look at your infant mortality. An African American baby is more than twice as likely to die within the first year of life than their white counterpart. Those are disparities that are related to the actual race of the individual, and particularly African Americans. Now, there's a lot to that.
Yeah.
It's not just a simple issue of people just dying.
Yeah.
There's lifestyle, there's socioeconomic issues, there, behavioral issues. There are a lot of issues that are very complex that create that outcome. But at the end of the day, those are the disparities, and the you can call them inequities,
Right.
because there are a certain number of things that are not equitable that contribute to those outcomes.
And I want to get into the intersectionality of like what are other things that are not equitable that also results into poor healthcare.
So now you're crossing over into what is commonly referred to as the social determinants of health.
Okay.
Social determinants of health, those social and economic conditions that will contribute to outcomes of an individual's health.
Okay.
Okay. Social determinants of health are key elements for driving health disparities. Social determinants of health are things like access to food, access to housing, access to transportation, where you live, where you play, where you work, where you grow, where you age. Those are all social determinants of health. And those things will have a major impact on the health outcomes. Go back to COVID. The reason that we saw those disproportionate outcomes of death and mortality under COVID was due to social determinants of health. It's basically it's the element that is the key driver of health disparities.
What does a organization like Nashville General Hospital play a role into those things in a community like Nashville? How does Nashville General Hospital, or even what is your role in combating some of those other social determinants that play a factor into the type of healthcare or lifestyle healthcare that people have or don't have?
Well, the first thing you want to do in healthcare as a healthcare leader is to make sure that the healthcare is equitably distributed to populations regardless of their race or their ethnicity or their language or their socioeconomic status.
Is that the case for Nashville at this moment?
I can't say in total.
Okay.
What I can say is that for Nashville General Hospital, we're the public hospital, which puts us in a good position to be able to say whether you have the means to afford health care or not, if you show up at Nashville General Hospital requesting care, you're going to get an excellent level of care, and that is indicated by the fact that as a public hospital, which is one that cares for the indigent population, the majority of our patients, as we sit here today, over 60% of our patients are patients who have insurance and who can go anywhere in the city. But at the same time, no patient that does not have insurance is turned away.
Right.
So that means that we are welcoming you if you don't have insurance. But some of the factors that causes that will have to do with obviously your socioeconomic status, right? Your wealth. There is a social gradient of health that trends that the higher your socioeconomic level is, the better your health outcome will be. So it tracks along that trend.
Is there, because doing my research for this, right, I realized that maybe Nashville General Hospital doesn't get enough recognition for all the amazing, like, national leading things that you all do, especially serving communities that can't afford health care. Is there a stigma or a myth associated with public hospitals in general that make people want to say, I don't know if I want to get service or medical attention there, and let me go somewhere else that may be more expensive, but they have the fancy name, right? It is publicized. The propaganda is different.
Of course there is. And there's this scintilla of justification for that. Because statistically and in the science, it will show that the hospitals that care predominantly for indigent populations or marginalized populations will tend to have a lesser quality. What you have to do is you have to be cognizant of that tendency, because oftentimes individuals will take the mindset, well, they don't have resources anyway, so why should we go all out to care for them? Or they're not going to be compliant with the care that we're providing to them, so why should we go all out and produce all the resources? Right. It's going to be wasted on them. That can be an attitude. We flip that upside down, and we say that everyone deserves excellent health care and access to health care. Health equity is really all about every individual having the opportunity to maximize or optimize their health. That's health equity. That is a social justice issue. Right. No one deserves to be deprived of that opportunity to maximize their health outcome. There is nothing in our Constitution or anywhere else that would justify that. Therefore, it becomes a social issue, hence social justice.
Right. Social justice is what I do. I love social justice. And I don't think there's enough conversations around healthcare social justice, especially locally here in Nashville. So I want to dive into you of what are some of the opportunities or even maybe challenges when it comes to healthcare in a city like Nashville now that's quote unquote its city. 90 people a day are moving here, but we understand and we see quite blatantly that this city cares more so about tourism, probably more so than the people that actually live here. That people are probably more so cared about, what's going on downtown, having fun, but like there's an affordable houses crisis. There's a education crisis. There's a healthcare crisis, right? All of these things are happening, they all intersect. Being the CEO of Nashville General Hospital, do you see challenges or opportunities, and what does that look like?
So in Nashville, the healthcare industry is probably the number one generator of resources and wealth in Nashville. Nashville is considered the healthcare capital of the nation. of the world,
Wow.
arguably. It has grown immensely over the years. So as a public hospital, one might think that you need to be at that level of healthcare delivery. You can't have the public hospital dragging up the rear of healthcare and healthcare delivery, healthcare outcomes, and the ability to survive in a community where the healthcare national recognition is such as Nashville. So Nashville General Hospital has some big shoes to fill. I think Nashville General Hospital is performing better now under than it's ever performed, as far as in comparison to its own leadership. At one time, Nashville General Hospital did not have its own leadership. It was led by other institutions. So now the people that run Nashville General Hospital, the team that's there, are all employed by Nashville General Hospital under the hospital authority and the board of directors. So it is performing well. We are working with evidence-based methodologies. The models that we use, the chronic care model, patient-centered medical home, patient-centered specialty practices, those are all evidence-based models. And so essentially, we are working with producing healthcare delivery according to the science of healthcare. Science has always been the driver of medicine. Healthcare delivery has not so much been utilizing the science and the metrics and the evidence-based models that we're utilizing. So that's how we're generating the outcomes. That's what we're doing to make sure that the health care that individuals are receiving is equitable across the board, because we utilize the models that engages the entire population as far as the education. We have a food pharmacy at Nashville General Hospital, which is a concept that addresses food insecurity, because if you're serving the population that has most likely to be indigent, there's a high likelihood that food insecurity is going to be a part of that. And so
food apartheid, right?
Right. we have a food pharmacy where it is a physical location in the hospital where patients are able to come. If they test positive on a questionnaire that says they are food insecure, then their physician will write a prescription for them to be able to come to the food pharmacy where there is fresh fruits and vegetables, there are shelf-stable products that they can come, and a dietitian works with them according to the doctor's order to get food to them so that they can continue to have food that is healthy to their bodies. And we should eat our food as our medicine. Yeah. And you know, the adage is that you should eat your food as your medicine, or you will eat your medicine as food. And so we're trying to make sure that individuals don't come to us struggling with food insecurity, where they're having to eat foods that have high sugar content, or the white breads, the oils that are unhealthy to their bodies, because it's just going to exacerbate their health outcomes and make them worse. And then that's not good for them, and it's a higher cost to care for them. So it's a win-win when we provide that food to them. This is one of the social justice things that we do to make sure that that playing field is not uneven for the individual who does not have the means to buy proper food to nourish their bodies. And so we are doing those type things to offset that mindset that if you're going to a hospital where indigent patients are cared for, then your care is not going to be as good. Quite the contrary at Nashville General. Your care is going to be excellent. It's where I get all of my care. My family gets their care at this hospital. And it's not just because it's my hospital that I do that, but I trust these individuals. I know these individuals, and I know the quality whether it's the physicians or the nurses or the techs or whomever, we know these people and how they perform.
Right.
So,
how can Nashville community members be a part of that healthcare social justice role? Because I believe, we all have to participate in the change we want to see. Regardless if you're a healthcare expert or you just want somebody that just cares about health, is there an entry point where somebody in our Nashville community can say, hey, I just listened to this podcast with Dr. Webb. I want to be active. I want to be used in some type of particular way. Maybe I have a family member, a peer, or a friend that I can connect with that I want to be able to be of some service in this social justice of healthcare. How could they plug in? How could they be a part of that work? Maybe through Nashville General Hospital.
well, first of all, let's understand that this is the public hospital.
Right.
So for those individuals that are listening to this podcast and in and around Nashville, particularly if you're in Davidson County, Nashville, this is your hospital. You own this hospital.
Right.
Because it is the public hospital.
Right.
The funds that go towards supporting that indigent population that we care for, that comes from the city. That's about a 35 or 40% of the overall operating budget that we have, but it is a commitment on behalf of the city to care for its own indigent population. So you, population, represent the city.
Right.
It's not the council, it's not the mayor. Those individuals spend their terms and they move on. You remain the owner and you select your leaders. And what happens is that individuals tend to fade into the background once they select their political leaders and they don't have any more interest in the social issues that are taking place. But the social issues that take place are largely driven by the policies that are put forth.
Right.
You elect these individuals to put forth policies, but at the end of the day, you're the owner.
Right.
You hired them, you selected them, you voted for them, and they are to carry out the duties and responsibilities that you want them to carry out. But don't get it twisted. You're still the owner of your taxpayer dollars go towards helping to support this population. Now, if you want to do even more, then, we have a foundation, we have volunteers, there are contributions that can be made. The food pharmacy, for instance, that's feeding the populations. We're able to use Second Harvest as a source of food for that population. We also have our own dietary services that we can contribute to, and our employees contribute to the foundation, and a portion of that is earmarked as well. So there are all kinds of ways that you can contribute. And if you want excellent health care, I would suggest that you go to one of the facilities that are Nashville General. We're all over the city. We're in Midtown, we're in Metro Center, and these are full ambulatory clinics. Midtown, Metro Center. We're here at the Bordeaux facility, and then on the campus of Nashville General Hospital, the main campus on Albion, we also have ambulatory sites there. So that's how you can get involved.
Yeah, I just think it's crucial, even how you just broke that down. As a person that's from here, I don't think too many people that grew up here really looked at it in that context of just public health care and how, like, hey, this is our hospital. This is coming out of our pocket, and like we need to take advantage of this. We need to, but again, I think it plays a part too. Again, it's like, and I want to ask you this: how does the Vanderbilts of the world, the St. Thomases of the world, is there cohesion in working togetherness in our healthcare system with a Nashville General Hospital, or are people working in silos when it comes to healthcare? And like the Meharry's, which is right across the street, is it cohesion amongst trying to provide Nashville with the best healthcare, or are some institutions or organizations of healthcare want to just do their own thing?
Okay, so first thing we need to do is to separate the hospital from the medical school.
Okay.
Right? The medical school trains physicians and they engage to a certain extent
Okay.
to care for population. But the main thing they're doing is educating students. Now, when you have an academic medical center, you have a hospital and you have a medical school,
Okay.
right? The medical school is responsible for recruiting, training, and educating. They utilize the hospital as the site for training their students. Now, as far as silos, I can tell you this, not just looking at the Vanderbilts or the Ascensions or any of the other hospitals here. Across the country, hospitals tend to work in silos. It's because in this country, healthcare is basically a market product.
Okay.
Okay, so there's not a tendency for them to share information with one another. Basically, they're competitors.
Okay.
It's healthy competition, but that's the nature of healthcare in this country, because as we look at it, healthcare does not appear in the Constitution as a right.
Right.
So it becomes then a market product like a car
Right.
or a refrigerator. You purchase it. You've got all kinds of commercial insurance. You have for-profit hospitals. You have not-for-profit private hospitals, which is what those you just named are.
Yeah.
Vanderbilt and Ascension, or private not-for-profit. HCA is for-profit. Either way, you're in pursuit of a share of the market.
Right.
That's the nature of the business. And so Nashville General is also in pursuit of the share of the market in order to remain financially viable. You can't just depend on the subsidy that covers the indigent population. That only covers that population because otherwise that would be a void.
Okay.
And how could you take care of someone when you don't have the resources to take care of them? If they don't have the resources to pay or to cover the cost, then it's hard to do that unless you start to experience negative margins, and nobody can operate with negative margins for long, right? So the city steps in and says, we're going to cover the cost of that population in the city who are the least among us and cannot pay for their health care, right?
Right.
And for us, again, that comes to about 35 or 40% of our operating expenses. The rest of it, we take care of by billing and collecting revenues and running the business.
Right.
So, but for the other private systems, each system operates on its own and competes for market share, and that's the reality of it.
Okay. Yeah, see, that's a masterclass explanation you just gave. Because as a person that's not in healthcare, just thinking of like what is best for community, right? Seems like we the healthcare hub of the country. It seems like, hey, everybody will be trying to service the community to the best of their ability.
Now, if you were living in Canada, Canada has a whole different type of healthcare system. In Canada, healthcare is a right within the Constitution, and so all healthcare in Canada is devoted towards. Now, I'm sure they have different levels,
Right.
some semi-private, some maybe not so much, and more of a universal style.
Yeah.
We in the United States, like it, don't like it, whatever. It is the nature of the industry that it is a market product that drives competition. Now, we have some of the best healthcare in the world, but from an overarching standpoint, it is not under a universal system. It is more private systems across the United States.
If it's one thing that you could snap your fingers and change about our healthcare system, what would that be?
It would probably be having a more centralized focus on outcomes.
Okay.
Rather than being so consumed with market share. Now, that would be one heck of a snap.
And can you break that down? So when you say outcomes, meaning
Outcomes, mortality rates.
Okay.
Mortality rates, infection rates, morbidity rates. Just go back and look at COVID.
Yeah.
See, anytime you want to really take a look at a contrast in healthcare and identify some of our real issues, go to the COVID era.
Yeah.
And you see disproportionately, what happens is under any major disasters or catastrophic situations or epidemics or pandemics, the marginalized and the people of color will typically not fare as well in healthcare. Statistically, it shows that. And I'm not just making those up. That is the science that shows that.
But this is during that pandemic time. This is what was surprising to me. It's like as black people as a group, we know when it comes to healthcare, we at the bottom, right? Of disparities being listened to, serviced, and then you have COVID-19, and it just exacerbated, like even more so. And it's like, well, why? Well, we knew this always existed. Why did it take something like a pandemic to make everybody else wake up? And even after everybody wakes up, like, what are we still doing to make sure like this population is equitably treated the same way in healthcare? That's what I don't understand a lot of times, Doctor. It was like, why? Like, we know like this is an issue. Why can't we just find solutions to this like right now, today?
Because the concept of how these resources are distributed and the behaviors that exist among the different races and ethnicities, the level of wealth that exists among races and ethnicities is pervasive. It affects other industries as well. You just don't see it as clearly as you do in healthcare, because there is a distinct outcome in healthcare, meaning that with bad outcome, people are likely to die.
Yeah.
And so there's nothing more attention-getting than death and mortality.
Yeah.
Like if you're in the hotel industry, for instance, you won't see that.
Right.
Or if you're in the car manufacturing industry, you won't see it. It's there.
Right.
Because it's not just limited to healthcare.
Right.
Those inequities and those things that create certain outcomes. In the car, let's say in the automobile industry, look at, say, who might be the higher level executives. Look at the types of jobs that the populations might have. You will see disparities within that. The difference is that doesn't result in death.
Right.
That doesn't result in mortality or morbidity.
Right.
And healthcare is the essence of who we are. Our health is the essence of who we are.
Right.
If you don't have healthcare, then you will tend to lose your health.
Right.
Once you lose your health to a certain extent, not much else is going to matter.
This is an election year for the country, for the United States. And of course, healthcare should be at the top of everybody's mind, just in general, but definitely when it comes to an election year. What are some things people should be considering, thinking about, have on their mind, questioning our elected officials if they get a chance to speak to them, or thinking about who they may vote for or may not vote for when it comes to healthcare and policy in particular?
The most critical thing about healthcare is access. You can't really gain access in an equitable way if you don't have the resources to do that. Right. Therefore, an expansion of access to healthcare could come, like for instance, the Affordable Care Act.
Right.
People refer to it as Obamacare. I mean, it's covering millions of people. If you remove that, you're going to see an exacerbation of people dying because they won't have access to health care. Right. And what we have to understand and what we have to communicate to our political leaders is that there is an outcome when people don't have adequate access. If you don't have adequate resources, that's going to constrain your ability to gain access. So the Medicaid and other form of health care insurance that you can gain or get will help you to eradicate some of those bad outcomes because it gives you more access to health care. And that's just a simple equation. If you don't have access, you're going to experience epidemic outcomes of mortality rates, just like you did with COVID.
Speaking of access, the way people access Nashville General Hospital may change. We know, I think discussions in 2023 about the lease being up and looking for a new location for Nashville General Hospital for preferably 2027. What is the updates on that? What are your thoughts? What is going on? What is maybe some primary locations for the next campus for Nashville General Hospital?
Okay, so we started this journey in 2018, presented to the board that the lease is going to be up in 2027. Mm-hmm. We need to start thinking about whether or not we're going to remain here on this campus or if we're going to look to build a new hospital. So we had the feasibility study done. A firm came in, engineering, architectural engineering, mechanical engineering. Firm came in and looked at the facility and gave us feedback on the feasibility of renovating this facility versus going to a new facility. And hands down, it was, you're going to need a new facility. So fast forward, after COVID, we had that feasibility study done again with our owner's representative involved, and it revealed the same thing. So we shared that with the board. The board voted unanimously that we need a new hospital. So 2027, the lease expires. Previous administration did not get around to addressing the issue that was put before them. So this mayor received that information, that the documents and all of the preliminary work that was done by the hospital team to show where the new hospital needs to be built, or not the location, but that it does need to be built. So now we're at a point of determining with the city what that location is going to be. It needs to meet certain criteria.
Right.
We talked about access.
Right.
It needs to be accessible from across the county because it is the county's hospital, not one side versus the other. Right. It needs to be centrally located, needs to have access, major access, so that individuals can catch a bus or drive their cars and all of that. We've looked at preliminarily, we looked at several sites, and the talk was about the Metro Center site. Now, that's not something that's guaranteed. It does meet the criteria, but it wasn't an area that was guaranteed that we would be able to gain access to. So 25 to 30 acres of land is what we need. So right now, we're in dialogue with the mayor, who has said that he wants to put together a team from his office to work with our team and others to identify the land that the hospital would be placed on. So right now, the book is still open on where that would be. We're hopeful that that's going to occur soon, and we can get to the business of identifying the land and moving forward with putting the plans to build in place.
Yeah. I advocate for Metro Center. It centralizes right there. Hopefully our mayoral administration, gets on top of that. 2027 will be here before we know it. We already in 24, so 3 years it'll be here. So it still has to be built. Time flies. Yeah. I always like to give my guests an opportunity to close. If there's anything that you want to extrapolate on, or something that we didn't talk about that you want to, address and put at the top of the conversation, I want to give you the opportunity, Dr. Webb.
Yeah. One thing we didn't, and I kept thinking about it, but we had so many things.
Yeah, that's why I say, that's why I was like, we got time.
But I want to just share with people the concept of the Congregational Health and Education Network.
Okay.
Commonly referred to as CHIN. It is a group of churches. There are now 108 churches that are members of the CHIN organization. It is a 501c3 tax-exempt corporation, and it has staff, and the hospital works with CHIN to reduce health disparities.
Wow.
It is based on the premise that education attainment is the number one social determinant of health that can change the trajectory. So from a longitudinal standpoint, we're working with these faith-based organizations because we know that historically, and it's in the science and proven that particularly African Americans will tend to turn to the church to get information, advice, direction, resources, all of the above, and the close connection to the faith-based leaders in the churches. So we believe that if the hospital connects with this organization, this entity that has been created as a collaborative effort, that we can drive a longitudinal effect that places particularly African Americans in a better socioeconomic place. Because as I mentioned earlier, the social gradient of health basically indicates that your wealth will determine your health outcome. Yeah. The more wealth you have, statistically, the better your health outcome is going to be. So if you are someone who does not have an education, and then I get you that education, now you can get a job that's going to be probably paying better. You will be able to gain access to all of those things that contribute to the social determinants of health, and now they become better for you, right? So if I can take a whole population, and from a longitudinal standpoint, we're working with churches and we're working with local educational systems to help to gain access to education. We have staff that are going into the churches to determine what their needs are. We're working with Nashville community, the community college here, and other colleges and universities in the city to make sure that we're helping to connect and bridge that gap. And I know one of the questions that's typically asked is, how does someone get into the business of what I do?
Right.
How do you become what CEO, if someone wants to become a hospital CEO?
Right.
What do you need to do? My response to that is, you need to do it. You just do it. Yeah. Now, what happens is, if you make up your mind that that's what you want to do, then seek out someone who is in that business. I personally never turn anyone down when they say, I want to talk to you. I would like to talk to Dr. Webb about how I get into healthcare administration.
Right.
I never turn anyone down. It takes 5 or 10 minutes to tell someone, here are some things that you would need to do. First, you need to get into a university or college program that trains for that business, and try to get into one that has a residency program, because that's where you will get placed. So there are a few that are top of the line that I would say you need to get into this one now. If you've made up your mind, but if you come to me and you haven't made up your mind about what you want to do, you probably need to go back and then come back when you do, because I can't.
Need to be clear.
Yeah, I can't get into all of that.
Right.
But if you are, whether you want to be an engineer or a hospital administrator or whatever you want to be, I can talk to you about it, but you need to know what it is that you want to do. So do your homework. Now you got all these social media platforms. You got Google. You can do all kinds of stuff. Google hospital CEO. It'll tell you a lot.
Right.
But if you really want the real live version, then find someone who is in that industry.
Right.
And I personally always make myself available.
Well, Dr. Webb, I appreciate your time for making yourself available for me to really give us a master class on healthcare, Nashville General Hospital, and just what's going on, but also being an inspiration for people who may want to be, the next CEO of a hospital, wherever they may be, Nashville or anywhere else around the country or the world. So thank you for your time.
I think healthcare is the greatest industry in the world. So.
Hey, and that's why you get paid the big bucks, I appreciate you. Thank you.
All right. Thank you.